The points that Dr. Draper sent over to us. Evan, let's talk about getting a hearing test, the very first step. I mean, before you have a hearing test, what are some of the symptoms that you sometimes hear from your patients that they come into you for a hearing test? There must be some commonalities that are out there. Can you share a few of those, and then let's lead into the hearing test?
Sure. So, a lot of times you will have a spouse who's the impetus to get the hearing test. The spouse notices that the person's not hearing so well. Somebody might have had their suspicions that they're not hearing well. People tend to notice it first in background noise. Maybe they go out to a restaurant, a bar with a bunch of friends, coworkers, and it's like, I can hear you fine, but when I get in this environment, I just cannot make out what people are saying and all the background noise. But there are lots of ways that people tend to notice, and I just want to make it as simple as possible. Just get a hearing test. It doesn't hurt. It's easy to find. Uh, we don't usually notice our hearing changing. A lot of times I'll test people's hearing and they're surprised by what they're missing. So even if you don't think you need it, even if you don't think you have a problem, just go and get a hearing test. It's good to have a baseline for ongoing measurements. It's just something that anybody can do pretty easily when you start to look.
Almost sounds like a hearing loss could be like your blood pressure. It's one of those insidious things that's sort of under the surface. You don't even know what's going on. You don't even realize it's happening. Is that a good analogy?
You might know more about blood pressure than I do at this point, so I will defer to you. But you may notice your hearing changing very slowly as you age. You may be missing only part of the sound spectrum. There may be part of sounds that you're hearing just well, and it's very easy to not be able to tell what you're missing.
Talk about that. What does that mean? Explain to the listeners what you mean by that.
So, audiology has a very kind of strange professional landscape. There are two kinds of professionals that work with hearing, and from the outside perspective, they may look identical. I'm an audiologist. That means I got a doctoral degree 4 years after my bachelor's. I had plenty of clinical time, training, exams. Um, I know a lot about how the medical systems of your body and hearing loss are related. Now, there's somebody else on the market called a hearing instrument specialist or a hearing instrument dispenser. A lot of times, those folks might just have a high school diploma, maybe an associate's degree. It differs by state, but it used to be that audiologists did the testing and they did the diagnosing. So they diagnosed the hearing loss, they gave you a hearing test, but then they sent you to a hearing instrument specialist to get your hearing aids. Kind of like how a doctor diagnoses the disease, but then there's a pharmacist who deals out the pills just to make sure that the doctor doesn't have any ethical, conflicts when they're prescribing and selling medicine. So the problem is that hearing aids are a lot more complicated than a pill or a shot. And audiologists started getting involved in the fitting and dispensing of hearing aids. And meanwhile, those hearing instrument specialists said, well, I can do a hearing test. It's not that hard. So in a lot of states, you have these high school educated professionals and you have these doctorate level professionals doing what looks like the same kind of work. So you might go to some place and be interested in getting a hearing test, maybe purchasing some hearing aids, and you don't really know from the outset. Are you working with somebody that graduated high school or got a doctorate degree? So look for an audiologist. They have expertise that hearing instrument specialists don't have, whether they have a doctoral degree or whether they came up through the older system and they have a master's degree. But make sure you're finding an audiologist. They will send you to an ear doctor, a physician, an otolaryngologist. If you have some kind of medical issue that needs a closer look, that might need a surgical procedure or, some kind of treatment.
How do people figure out which ones to get? And in your opinion, what's the best way to make the best choice for your bang for your buck?
Sure. So I agree. There are just so many devices out there at just a wide level of price points. Um, Roughly speaking, you do get what you pay for in terms of performance from the device. So you can find some over-the-counter things out there. You can find some things for three figures. You can find some things for maybe 1,000 or so. List price of some of the best hearing aids on the market, we're talking maybe 6,000 a pair or so. Um, Generally speaking, the more you pay for the devices, the smaller they're going to carve up that sound spectrum and give you better sound quality, especially in background noise. So cheaper devices will make things loud enough for you to hear, but you get into a restaurant, a crowded room, and it's just going to feel like a wall of sound. So there is value to getting the expensive devices. If you want to start with a cheaper device just to see what it might be like, just to get your toe in the water, I don't tell anybody that's a bad idea. We want to get you help with your hearing if you need it, and you start wherever you need to start.
Where would a consumer or patient, I mean, can you go to Amazon? I mean, how does this happen? Do you just you get a brand? You say you go to Aunt Millie's house, and Aunt Millie's got the Zebra 4000, and you want to get the Palomino 4000. I mean, where do you buy these things? I mean, you just gave us kind of a ballpark idea on its cost, but where can you buy these if you wanted to try something, dip your toe in the water, as you said? And then I had another question coming at you, but let's start there first.
Yeah, so the landscape, the marketplace is a little messy right now because maybe about 3 years ago, the FDA signed a law allowing the sale of a certain class of hearing aids over the counter. It used to be that what was strictly called a hearing aid was a prescription device and it had to be dispensed by somebody like an audiologist or a hearing instrument specialist. And then you had things that you could get maybe that made things a little bit louder, but were not legally able to be called a hearing aid. So they might be called a personal sound amplification product.
Oh.
So the FDA decided that, well, we want to make these things cheaper. Hopefully, that'll get more people to wear them. So we're going to create this class of products that are available over the counter. I don't necessarily agree with that decision, but it may be the right choice for some folks. So generally, any place that you go where you have to get a hearing test, you can be assured that you're looking at some kind of a what we generally call a prescription hearing aid, something that's dispensed by hearing instrument specialists and an audiologist. Something that you can get maybe at a drugstore or online. You may not have the availability of that professional to modify, to program, to troubleshoot those devices. And let me tell you, that's really important. I see folks all the time, just this morning, who have spent a good amount of money on some prescription devices, really good quality. And, they're not thrilled with them. They're on the fence. They say, I don't think I like this brand. I'm going to get a different one. They come to me. I do a hearing test. I do some quick tune-ups and they enjoy these devices like never before. There's more clarity, there's better speech discrimination and background noise. A lot of people can get you a hearing aid, and the device generally will be as good as what you pay for it, but a big part is the expertise of the person setting it up.
That's but how important is that? I mean, that seems like it would be huge.
Yeah, so obviously, if you're not hearing very well out of your hearing aids, that might not be a medical problem. Certainly, it is a possibility, not a very high one, but you could be wearing hearing aids that are too loud for you, that are damaging your hearing further. I don't want to overstate that case, but there is another aspect where there are plenty of folks I see that have uh, a medical issue underlying their hearing loss. They've had hearing aids, maybe a couple pairs for several years. And I ask them, are you having any dizziness? Are you having noise in the ears, ringing, buzzing? Do you feel like your hearing is different from day to day? Yeah, I think you ought to get something looked at a little closer. Nobody ever asked them that question. Everyone just programmed the hearing aids according to the hearing test. So any one of these medical issues is typically rare, but it's common enough that, I mean, I see somebody every month, closer to every week, that has some kind of medical issue that needs a little closer look. So I hate to see folks go for years with undiagnosed medical issues that might involve dizziness, noises in the ears. That should be addressed as soon as possible.
How bad can that be for us having loud music like for those periods of time? Is that like, I know the answer, but I'm going to ask the question anyway. I'm putting myself on the cross here, but go ahead. Tell us, Doc. What am I killing my ears?
It's tough to know, Tom. I would just say for your penance, go get a hearing test. Go get an updated hearing test. But sound exposure can cause hearing loss. Absolutely. It's a dosage equation. So it's basically how loud it is multiplied by how long it is. So, I mean, if you're standing right next to an airplane jet engine, it only takes a second for that to permanently damage your hearing. If something is down at 80 decibels, you could probably listen to that for an 8-hour workday and not have any adverse effect. So the louder it gets, the shorter you can safely listen to it. Um, I don't see a lot of folks that are really blasting their music and giving themselves hearing loss, but those are the kind of folks that go to a couple of concerts and stand right near the speaker, and that is it. So there's a lot of apps out there, things on your phone that you can check the decibel level of your music. Make sure you're getting safe output. But I can barely do those calculations myself, so I couldn't expect anyone else to do it who's just listen to some good songs while they're pumping iron.
Well, I was, and you read my mind there about the concert stuff because I remember back in the young Tom days, back in those party days when I did a lot of concerts. I haven't done one of those in a long time. That's I'm past that now, but good takeaway from you. You got a couple minutes here where you can talk about hearing and some of the things that we discussed today, Evan. What would you like to leave the listeners with all over the world that listen to the podcast and the broadcast? Go right ahead, talk about it, take a little bit of time, and share your recap of today's episode and things you would like people to remember from today's show.
Sure, I'm just going to go over those bullet points again. Number one, get a hearing test. Just do it. It's easy. You can usually get it cheap, for free, covered by your insurance. Just go get a hearing test. Find out what's going on. When you get a hearing test, look for an audiologist because they have expertise that you need when it comes to treating and diagnosing hearing issues. Now, hearing aids can help a lot. You can spend a lot of money on some really good hearing aids, but the expertise matters when it comes to programming and setting up those devices, making sure they're what you need and not somebody else with a similar hearing test. And make sure you get an audiologist who performs real ear measures, who's actually testing what the hearing aids are doing in your ears and what they're sounding like. And Tom, I just wanted to show you a quick surprise here. I don't know, can you see this right here? I've been
I
wearing
I
hearing
can
aids
now,
this
but the
whole
listen,
time.
the listeners on radio can it. What I'm looking at, everybody, is a very small hearing aid that Evan just pulled out of his ear. Do you wear that all the time?
I don't, but you know what? They work really well as wireless headphones. So it was the easiest thing to do for this video conference here. You can get most hearing aids will connect wirelessly to your cell phone, to your computer, and you can stream via Bluetooth, get excellent quality sound. These hearing aids are picking up my voice and streaming it to you. It's not even the microphone in the computer. You can use an app to modify the settings on the hearing aids, change the volume. They do a lot of great things that you wouldn't expect, and they're small and discreet. It's
What?
fantastic. Go get a hearing test.
That was great. Evan was a very interesting guy. I met Evan several years ago when he got married to my favorite niece, Emily. And Emily helped set all of this up. She's one of the smartest young women I've ever known. Emily is. But Evan's super smart too. And their son, Dexter, kid's crazy, crazy, cool kid. I want to say thank you to the family for coming together for this. The world of sound. Let's talk audiology. This is something I haven't done before. I said that several times during the episode. And it's like, I want to do more of this where we bring these specialists in. It's almost like part of the performance living. And we will put this in the performance living category because to perform well in life, you've got to have good ears. You got to be able to hear what the heck is going on in the world. That's it for today, everybody. We'll talk to you next weekend. I am Papa Tom. This has been the Tom Matt Show. Peace out, everybody. Love you so much. Thank you so much. Please subscribe. Please utilize our sponsors and help us stay on the air. Until next time, good night now.